I think it is important, and I know this is about the amount of data people collect and the amount of information, etc. But actually, unless a board is receiving an appropriate level of information that is meaningful, actually the board's effectiveness is nullified. You might as well take them out of the equation because they can't respond or react to what's going on if they're not getting the information. So there is something about the sort of necessary evil of feeding the board the right and appropriate information. As I said earlier, few boards still routinely receive assurance around the nursing care indicators. And going back to the kind of hydration, nutrition, soil beds, call bell responses. It's in the too difficult pile for most trusts because it'd have to be a manual data collection system because there isn't an off-the-shelf electronic system, or there aren't many that are being developed, but there are no easy wins in terms of getting a system and reporting routinely through the organisation. So it stays in the too difficult pile. But whilst it stays in the too difficult pile, we're still delivering poor care out on the wards, and we're not aware of it sometimes. What does assurance look like? Too often, a lot of the work that I still do, and certainly happened at mid-staffs, is there's far too much reliance on verbal assurance at the board. And even if it is a medical director or nurse director or finance director, it's all irrelevant. Yes, you should take a level of verbal assurance, but equally there's issues about triangulating that, testing it, challenging it, and understanding if we're not performing in a certain area, what are we doing about it? Who's doing it? And by when? So what will I see coming back to this board? And there's still far too much acceptance of a non-exec raises a point and says, well, I see this performance is not on track. What are we doing about it? Nurse or medical director will give a response and we say, thank you. And we move on to the next agenda item. And again, it's about holding the organisation to account and making sure it delivers. And there was far too much slippage at mid-staffs, far too much acceptance of the verbal assurance, and we just drifted month after month. So the next board meeting would be, well, I thought you said you were going to do X, Y. Yeah, well, these other things came in, got in the way. Next month, I'll do it next month, or I'll do it in 3 months' time. And it's that drift. And if you're not careful, it becomes part of the institutional behaviour, and it becomes an accepted norm that if you say you're going to do something, well, it'd be okay if it slips a month or two. And in that month or two, more harm can be caused to patients, potentially. So we should not be tolerant of drift in the organisation. And finally, around board assurance was around kind of integrated performance reporting. Most trusts will say they have it. What they really mean is they staple together their various reports under one cover. I'm not sure that's completely integrated performance reporting, but we have a finance report, we have a quality report, we have a HR report, all bound together, and therefore it's integrated. What the board is not necessarily seeing is an overarching set of indicators or performance for an area that encompasses the financial information, the activity, the quality, the HR by area. They see it in a functional way. So you get a finance report in its totality, you get a HR report, you get a quality report, but you have to almost put them side by side to try and get a sense of a position for a particular ward or particular area or function. So I think there are ways we can improve our performance and give the board a better picture, really. In terms of culture and accountability, Liam touched on some of the cultural environment that was at mid-staffs at the time. Absolutely, there is a need to be open and welcoming and transparent. There were, and the bullying harassment is a really subjective area because actually one person's hard-line management is somebody else's bullying. So I wouldn't profess to say whether there was bullying or not because it really does depend on an individual's take on it, really, being on the receiving end. But I think what is needed is consistency, about openness and welcoming transparency. The board have to get out beyond the boardroom. They have to be visible, they have to get into the organisation and really get out there to understand the services, understand the organisation that they are in effect managing at the top. There's a need for consistency in terms of your behaviours and reactions as well. And too often, some of the executives were seen to be too inconsistent in their responses. So, did you catch them on a good day or a bad day? Well, I don't know whether they're having a good day or a bad day, so I won't raise it with them. So again, there's a real need for consistency when you're out and about. There wasn't a framework of accountability or personal responsibility amid staffs. Very few individuals were being disciplined through that period for poor care. Fingers of one hand in reality out of kind of 3,000 staff, despite all what was going on. So there was this tolerance of poor practice. And what we tended to find at mid-staffs was there were a number of informal conversations between managers and staff, and we carried on having informal chats to the point where we suddenly said, right, I've had enough, you're going. So there was no kind of formal escalation of HR policies and procedures. There was informal chat, right, I'm sorry, that's enough. You're on final written warning or you're sacked. And there was no kind of escalation going through. And equally we had, as we said, we had out-of-date policies and procedures, so it was difficult to actually have that kind of framework of accountability. We talked about the Stafford way and the institutional behaviour. Clearly one of the learnings is actually that some external input or turnover of staff is good. You do need that fresh blood in the system. You need those fresh ideas. You want the young people coming through from universities with the new techniques and more modern practice, etc. It's good to have that kind of turnover. And we just weren't getting that at all. And to accept external input. Stafford was a very internally focused organisation. Despite the fact that from my office I could see the M6, one of the main arterial motorways of England, I could have been 20 years away. It's kind of set in the dark ages. We had the Stafford way. There was a lack of mobility in the workforce. People were born in Stafford, they worked in Stafford, they died in Stafford, and with very little movement around. But equally on top of that, we didn't bring in externals. We thought it was a sign of weakness as an organisation to bring in external organisations, either peer trusts or external experts. It was almost like we don't need them. You know, we know what we're doing in Stafford. We don't need that external focus coming in. Leadership took quite a battering within the various reports as well, understandably so. It wasn't visible and open. We talked about that within the culture as well. But the leadership was seen to sit up on the top floor in their management offices and not be part of the organisation, not understand the organisation, not get out and walk the walk, and therefore just did not know what was going on. Most trusts talk about that we are a quality organisation. We put the patient first, and we get lots of strap lines now in the NHS about putting the patient first, at the heart of what we do, etc., because we care. If we're not careful, though, that can be just a strap line, and it's about getting beyond that to say, well, what does that actually mean, and how do we actually implement that? And too often trusts tell us that quality is implicit in everything they do. Well, if I'm a patient or a relative, I don't want implicit quality, I want explicit quality. Something about being seen to operate with integrity and values, leading from the top and having that high value of trust, really integrity of an individual as well. And evidence-based and performance-focused appraisals. And again, throughout all of this at mid-staffs, there is very little evidence-based performance appraisals going on. It's still seen as performance and development. Annual meetings are seen as a developmental meeting, not a performance meeting. And there wasn't that balance of both within the organisation. In terms of relationships, we've talked about the internal focus, not proactively seeking the external feedback. The senior team certainly needs to be more outward facing, and having those relationships with external stakeholders, proactively seeking feedback from external stakeholders. And there's a whole myriad of external stakeholders out there that we all touch and rub against on a day-to-day basis. And as importantly, want to be a learning organisation, want to constantly improve, constantly evolve, constantly take on board the latest thinking, etc. And speed of change. There were a number of criticisms in the report around when the new team came in. There was some criticism around how quickly or not they put things in place to improve things at Stafford. And I think because there was so much to do, what they didn't do was necessarily prioritise things in the right manner and in the right order. And there is still something now, even with the Trust Board last week, who's spiralling out of control in a various number of indicators. Again, their feedback was, actually, we need to take one step back and understand what's important to us. What are we trying to focus on? We can't deliver everything in the next 12 months. So actually, what's going to give us the biggest return? What do we need to do for the patient? And let's prioritise and focus on those kind of main things to do, really. As I say, you need to become intolerable to organisational drift, and we all see evidence of it. We're all incredibly busy people. The organisation is incredibly busy. It is easy to get into that mindset of, well, I haven't had time to do it this month, I'll do it next month. And another month goes on, and another month goes on, and we have another set of incidents, or another complaint, or another serious untoward incident. And hold to account. That's certainly one of the learnings about actually holding people to account for doing the job. In terms of the structure, we revised the structure quite heavily. The dark green was the existing committee structure. So under the Trust Board, we had a Donated Funds Committee, we had an Audit Committee and Remuneration Committee. Everything went through the Audit Committee. We had this kind of integrated governance that went through audit. What that meant was incredibly long agendas, incredibly long meetings, and invariably money came first, quality, patience and all that important stuff came second, and we ran out of time, and we kind of just, we closed that agenda down because actually we've all got to leave at 5 o'clock type stuff. So we put in place a Finance and Performance Committee, we put in place a Healthcare Governance Committee, which would focus on quality and patient-related matters, and under there we separated it across the 3 kind of main national areas that the NHS looks at now around patient care, patient safety and patient experience. And that's really raised the profile of quality because it brought it out from audit and gave it its own home and its own kind of agenda, really, and feeding into the board. So it really raised the profile of quality matters in the organisation.